While people over 80 appear to be at greatest risk from COVID-19 infection, some at the opposite end of the age spectrum are also vulnerable. They're hospitalized children with compromised immune system. That's led some medical centers to limit the contact that these young patients can have with their families, and obviously that can be traumatic. Maria Villarreal reports on what is being done to both protect these children and ease their emotional pain.
Robin Brezel is packing up and handing out more than 80 prayer bears on her own today. You are the last of the Mohicans, that there are no more volunteers?
Yes, I'm the last one standing from a volunteer standpoint that is here trying to get the bears out to the kids.
Most of the volunteers in the Prayer Bear program at Cook Children's Hospital in Fort Worth are over the age of 60. So for their health and patient safety, they were asked to stay home. Why continue to volunteer if you know there is a small chance that you could get this as well?
If I can do something to help a child or a family through a crisis, I'm willing to continue to do this during this time.
There are nearly 300 patients inside Cook Children's main hospital, many with compromised immune systems. They are part of a vulnerable group highly susceptible to the coronavirus.
Well, I've been out here about 23 days, and it's like I'm 17 days post-transplant, I think.
We FaceTime with 10-year-old Ella Planty from her hospital room. She needed a bone marrow transplant after being diagnosed with aplastic anemia, a rare autoimmune disease that cripples her ability to fight infections. What has been the hardest part about dealing with this?
Isolation. We've been practicing social isolation since November. She hasn't been to school since November. She's been homebound.
Not being able to go to school, because I love school.
As COVID-19 concerns escalate, hospital administration decided to scale back on patient visitors. Now, only 2 primary caregivers are allowed inside. Even siblings must stay out. Jill Claus, Family Support Services Director, says security is tight and social distancing is mandated. We are living in a coronavirus world right now, so that has impacted what you do here at the hospital.
We are having to separate families, which is really hard. We have a rule now that siblings can't come up to visit, and so we're trying to be creative in how we keep families connected.
Name 5 percussion instruments.
To keep connected, Cooks is ramping up in-house activities like their interactive television programs.
Kindergarten call. Yeah.
Recognizing that they still need to play, that they still need to do all those normal kid things. It's amazing how when kids start to interact and engage and do things that are expressive for them, how they start to feel better.
For now, volunteer programs are on hiatus in an effort to keep exposure to COVID-19 at bay. Hard to bear for longtime volunteers like Robin.
I'll just wait for the word when we can gear up again and get back to doing what we do.
For CBS This Morning Saturday, Mireya Villarreal, Fort Worth, Texas.
1, 2.
I can't even imagine what it would be like right now to be a 5-year-old kid fighting cancer, having to do it alone, not being able to see family.
And having spent some time at some of those children's hospitals, it's so important for the kids and the families to have that connection, and also to have sometimes the distraction of other people around, that this is making their battle twice as hard, it seems like.
On the flip side of that, people in elderly homes right now who aren't taking visitors right now, it is awful.
Use the communication, the devices that we can, I guess, is what people need to do right now. And as we saw in that piece, that they're able to use.
FaceTime, group FaceTime, whatever else you can do.
Whatever it takes.